अथ तो विसर्पनाडीष्टरोगचिकित्सितं व्याख्यास्यामः यथोवाचमुदान्दन्वन्तेः साध्याः विसर्पाः त्रय आदितो ये न सन्निपातक्षतजो हि साध्यौ साध्येषु तत्प्रथ्य गणैः विदध्यात् घृतानि सेकांश्च तथा उपदेहान. The Thidosha Visarpa and the Kshatraja Visarpa are asadhya. Other Visarpas are treatable. And then which are the Visarpas and their details we have discussed in the Nidanasana. And the whole formula of the treatment, protocol of the treatment would be by using Ghrita, Seka, Upadeha, etc. The details would be like Musta, Shatahva, Suradhar Kushta, Varahi Kustumburu Kushta Gandaha, Bhatatmake Usnaganaha Prayodyaha Sekeshu, Lepeshu, Tatha Shuteshu, Yat Panchamulam Kalu Kantakakyam, Alpam Hachapi, Athavadlijam Cha, Tacha Upayojam Bhisha Pradehi, Seke, Grise Chapratibataile. In case of Vataja sleeper, Vataja Visarpa, the treatment would be by making use of the Vata Hara Ushna Dravyas, Vata Shamika Ushna Dravyas, like example Mustan Shatahva, etc., which can be used for Zeka, Lepa as well as a Kashaya, or Panchamula, Kantaka Panchamula, Laghu Panchamula, or Mahapanchamula, or Vali Panchamula Dravyas. They are to be again used in Pradeha, Seka, Ghrita, etc. Now, the present what we see as a Vataja Visarpa would be where you will have that vesicle formation, typical cellulitis with the necrosis changes, like where there is a vesicle formation in the subcutaneous area. As we see, Padatmakaha, Asitamraduhu, Parushaha, Angamartha Sambheda Toda Pavana Jwaralinga Yuktaha, Gandehi Yata, Gandaha, these are the swellings with the vesicles which are formed. Vishamehi, Atilushitatva Saivakatras Khaluvarjaniyaha. It's also very difficult to be treated. It's absolutely true that in case of the necrosis conditions, it is quite difficult to be treated. Whenever a patient of this sort comes in, the most troublesome would be, most of the times it's due to a gram-negative infection, or occasionally Clostridium group of infections also can present the same, where the toxemia risks are very high. The patients may have more severe risk of toxemia, which can even be fatal. And the another is such conditions, they tend to spread very rapidly, and hence the antibiotic therapy may be necessary. Most of the times it may be life-saving as such. But still more important is early debridement. Even it's considered as a surgical emergency. All these kinds of erysipelas and related conditions are considered as surgical emergencies, and they have to be debrided as early as possible. Early debridement is the main part of the treatment. And to treat the toxemia and prevent the fatal complications of the toxemia are the most important things which you have to manage. And as I told you earlier also in the middle chapter, the chances of getting a patient in such a situation where you may apply Lepa or Seka would be difficult, because most of the times the patients would come at a delayed stage where that kind of an approach of Lepa may not be possible because the patients comes at a later stages. But once the patient's toxicity is managed, then the treatment can be Tripala Kukul Gandhikasana Sanatikvata. Niruha also can be helpful to promote the healing. It takes a long time for the healing because there will be loss of tissue loss, and hence a prolonged treatment would be required. Now, in the others, Kasir Shungataka Padmagundaha, Sashivalaha, Sotpala Kardamascha, Ustrantaraha, Pittakrite Visarpe, Lepaha Videyaha, Sakasa Sushitaha. In case of Pittaja Visarpa, who comes in early stage, Lepa can be done with the Shitavirya Dravyas, and the Lepa can be done not directly over the area, but keeping a bandage cloth over the area, and then over the bandage cloth the Lepa has to be done, so that the damage to the skin can be reduced. That's one of the special techniques there. Hrivera Lamajaka Chandanani, Slotaja Mukta, Manigarikishcha, Kshirena Pishta, Sakasa Sushita, Lepa, Prayajah, Tanamasukhaya. Another of the Lepa, where again Kshira Dravyas with the Kshira and Ghrita, the thin Lepa are applied over the area. Or another of the yoga would be Prapondrikam, Madhukam Payasya, Manjishtika, Padmaka Chandanecha, Sugandhika Chetichukaya Lepa, Paite Visarpe Vishja Prayajah. Another of the Lepa, where again similar Shitavir Dravyas like Pondrika, Madhuka, etc. are used. And Necrosavargaihi Parishetanancha Grisam Kuriyat Surasenatasya शीतैः पयोभिश्च मधुतकैश्च सशर्करैः इक्षुरसैश्च सेकान्. Necrothaliana can be used for the parishachana, the washing kashaya can be used for cleaning, or ghrita also can be given as such. The typical feature of acute erysipelas, and where you will have the typical presentation of a rapid onset of the conditions and systemic toxemic symptoms like jara, daha, paka, spota, prabheda, bahulah, kshatraja prakasha, it will be reddish in color, and दोष प्रवृत्ति हत मांसशिरः यदा स्यात् श्रोतौजकर्दमनिभनता नतदा सिद्ध्येत. When it results in a necrosis, necrotizing fasciitis like conditions, दोष प्रवृत्ति हत मांसशिरः, necrotizing fasciitis translation, and when it where there is lot of such necrosis and debris, then it becomes difficult to be treated. Generally, it is also produced due to gram-positive infection, not the gram-negative. So, whenever you select the antibiotic in such conditions, you would be preferring the antibiotics which would be selective for gram-positive infections. Toxemia risks also are very high, and as earlier, here also debridement is essential. Early debridement is necessary, and the further treatment, once the patient has been stabilized, the toxemia is controlled. Definitely the patient can be managed better with the Kaishara Gugulu Gandhaka Rasayana Kamaduga Manjistari Kwata or Manjistari Ksharavasti. With that we can manage a good number of patients. Then Ghritasya Gauri Madhuka Aravinda Rodhambu Rajadana Gairikeshu Tata Rishabhe Padmaka Sarivasu Kakoli Medak Mudat Paleshu Sachandanayam Madhu Sharkarayam Drakshas Chira Prishni Shatakvayasu Kalki Kradasu Udakamitra Dadva निग्रोध वर्गस्य तथा स्थिरादेः गणस्य बिल्वादिकपञ्चमूल्याः चतुर्गुणं क्षीरं स्थापितद्वत् प्रस्थं विपक्वं परिशेचनेन पैक्तीं निहन्यात् विसर्पनाडीः विस्फोट दुष्ट व्रणशीर्षरोगान् पाकं तथा अस्य निहन्ति पारात् गृहार्दिते शोषिणि चापिबाले घृतं हि गौर्यादिकं यत् इष्टम्. Another yoga which is specifically mentioned in case of Pitta Visarpa as well as all the other disease conditions which have wound and then discharges, like Gauriya Jigrita is mentioned, where the yoga is mentioned as such, where many of the drugs are Shitavirya Dravyas, and Grita can be given for local application as well as internal administration. Aja Ashwagandha Sarala Sakala Sakeshika Chapi Atava Ajashrangi Gomutra Pisto Vihita Pradeha Hanya Visarpam Kapajantu Shigram कालानुसारी अगुरु चोच कुंजा रासना वचा शीत शिवेन्द्र पर्ण्यः पालिंदी मुंजात मही कदंबाः हिताः सर्विश विसर्पेषु कफात्मकेषु. In Kafaja Visarpa, Ushnavirya Dravyas are used like Ashwagandha, Sarala, Ekeshika, Ajashringi, etc. with the Gomutra, and they are used as a lepa if the patient comes in the early stages. Typically, the presentation could be Kleshmatmakah, Sarati Mandam, Ashigrapakah, Snigdaha, Sita Shwetu, Alpa Ugra Kanduhu, where the patient will have more of itching and then less of discharges, thick discharges are often occurring, slow progressive, typically of impetigo. In the impetigo, of course, the risk of toxemia is lesser, but the patient would take long time, it would take long time for the healing. And usually I would prefer the treatment of Laksu Sekara Kaisharu Gugulu Khadirarista. Virechana may be the other option of the treatment, or similar conditions also can present in many other chronic granulomatous conditions. In these conditions, the toxemia risks are lesser, so hence that emergency is not a fact, right? Usually patients respond very well, but occasionally if the patients do not respond to these usual treatment, steroids may be necessary. Steroids are the other options which can save or prevent many of the serious complications. Then Gads Yojya Purna Pravataha Kriyasu Sarvasu Vichakshanena Samshodhanam Shonitamukshram Jashreshtham Sarpesha Chikitsa31 Sarvamscha Pakwan Parishodhiriman Branakramen Upacharayat Yathoktam. In all cases of the Visarpa, Varunadigana is one of the drugs which can be used in all types of Visarpa without bothering about the options. Then Shodhana, like Bhavana Virechana, as well as Raktamokshana also are suggested. And when it becomes suppurated, when the pus is formed, it has to be removed, drained or debrided. Debridement or drainage is necessary. and the treatment would be as you treat any of the wounds. So that's about the visarpa chikitsa in brief. Then comes the nadi. Nadi vrana, again we have discussed that in the Nidhanasthana, where the wound is not drained properly and it becomes chronic, there will be a tract formation and the treatment of the tracts would be difficult. And the protocol of the treatment is Nadi, Tridosha Prabhavanasi Chet, Sheshaha Chatastra Khalu Setna Sadhyaha. Tridosha Nadi cannot be treated, whereas the other Nadi vranas or sinuses can be treated with the difficulties. तत्र अनिलोत्थम उपनाश्य पूर्वम् अशेषद पूयगतिं विदार्य तिलैः अपामार्गफलैश्च पिष्ट्वा ससैन्धवैः बन्धनम् अत्र कुर्यात् प्रक्षालने चापि सदा व्रणस्य योज्यं महद्यत् कलपञ्चमूलं हिंस्रां हरिद्रां कटुकां बलां च गोजिह्विकां चापि सबिल्वमूलां संहृत्य तैलं उपचेत् व्रणस्य संशोधनं पूर्णरोपणं च. In all cases of the nadi vrana sinuses, the most important part is you have to prevent further accumulation of the products of inflammation. They need to be drained either by opening the tracts or keeping the tract open. You may have to cut open the tracts, or maybe insert something so that there is a proper drainage. So the most important part of the management of any sinus-like conditions is to reach to the lowest portion or reach to the distal most portion of the sinus and ensure that whatever the products of inflammation are produced, they are drained. So Puya Gati Vidarya, the Puya Gati has to be opened. Either it has to be slit open, or you may have to introduce something like a wick or maybe a thread or so on, so that it gets drained. So that's the most important thing. So once it gets drained out, then that further treatment is done. You may have to use the lepa, as Sushila has said, like Tileha Pamargapalesha Pishwa, Sasendehi Bandana Matapuriata. You have to put in a lepa and then put the bandage. And the options could be like Taila prepared with the Mahapanchamula, Himsa, Haridra, etc. Taila also can be used as such. Now, typically, in case of Vataja Nadi, what we see is typically in cases of the chronic osteomyelitis conditions where Parusha Sukshmamukhi, the opening would be small and then surrounding area would be hard as such. And Phelan with them Adhikam Sravatiksapayam, there will be more pus discharge at night when the patient is not moving. That's typical of a chronic osteomyelitis sinus. And in the chronic osteomyelitis sinus, the most important part is the exploration. Now, and whether the sequestrum, the dead tissue can be removed or not. So, if the dead sequestrum is separated, it can be removed. If it is not separated, it has become fibrous, then it may have to be curated out. But success of the treatment depends upon whether you can remove that debris or not. So, most of the times it's not possible, difficult, and hence the outcome cannot be predicted. Now, once if the exploration is not possible, the other option by which you can keep the condition somewhat stable with the minimum complications would be what I prefer is Swarnamali Nivasanta with Godanti and Paripatikara Chipala Gandakasaya. Duration of the treatment can be infinite. You may have to continue infinitely the treatment as such. Then Pittatmikam Prag Upanashya Dhiman Utkarikabihi Savayoghrutabihi Nipatya Shastram Tilan Agadanti Yastyaha Kalkehi Paripurayattan Prakshalane chapi Soma Nimba Nishaha Prayojyaha Kushalen Nityam. In case of Pittajanadi, again Upanaha, and with Upanaha, Sushila has suggested Utkarika, etc., or maybe with the milk and ghee. And then the drainage, surgical drainage is the other option. And then once follow surgical drainage, you may have to use a kalka or the taila of different drugs like Madhuyastic kalka or Somanimba Kashaya for cleaning. Now that's exactly what you see in case of the sinuses like fistulae nano, where there will be septic complications. And the patient would have also toxic symptoms, ischiorectal abscess which has been drained, and then there will be sinus formation. Most of the times, the majority of the fistulae nano produced due to cryptitis, they present with the similar presentation like where the systemic toxemia symptoms like tapa toda sadhana jwara bheda hetu, it can be a cause for the jwara and the other systemic symptoms. And Pitam Savati Adhikam Ushtamaha Supitata, there will be yellowish color discharge, often produced due to gram-positive organisms again, often, not necessarily. And in such conditions, again, early and effective drainage is the most important option. For drainage, either you may open and then put a wick, as you are shown in the diagram, or if the condition has become chronic and the patient has become stabilized, systemic toxic symptoms are not there, Kshara Sutra is the other option which we can use in the regular practice. And Kshara Sutra in case of fistula in has become now established and quite popular, and I will not go much into that part. Like along with that drainage procedure, and Kshara Sutra is a drainage procedure which can be used for the treatment and which has become now quite popular. And along with that, my preference of the treatment would be Triphala Gokula Gandhakarasana Asanadipatha. Then Shama Tribhandi Triphala Susiddham Haridhayo Rodhraka Vrikshayascha Ghatam Sadugdham Ranatarpanena Hanya Gatim Kostagatapi Syata. According to Shruta, if you prepare a Kshirapaka with or Ghatam with milk and prepare that Shama Tribhandi Triphala, the yoga, that can be used for the treatment of the wound sinuses, even if they are connected to the abdomen. Visceral sinuses also can be treated. The Nadim Kapotham Upanakshasam Kulatha Siddhartaka Shaktakinmehi Mrudu Krutam Yesha Gatim Viditva Nipatayet Shastram Asheshakari Dadyad Vrane Nimbatilan Sadantin Surashtraja Saindhava Samprayutpan Prakshalane Chapi Karanjanimba Jati Akshat Pilus Surasaha Prayodhyaha Suvartika Saindhava Chitrakeshu Nikumbhatandi Talat Rupikasu Paleshu Apamarga Bhaveshu Jaiva Kuryat Samutreshu Hitayatailam. In case of Kapaja Nadi, the Upanaha is the first line of the treatment in the early stages, and for the Upanaha you may use again Ushna Vijaya Dravyas like Kulatta Siddhartaka etc. And once it becomes softer, then you have to probe and identify the track. In case of the indurated sinuses, probing and identification of the track is one of the important issue, and then all that track has to be excised. According to Sushruta, it has to be excised. Nipate Shastram Asheshakari. As in case of bilateral sinus like conditions, the whole track has to be removed, and then once it is removed, then the wound has to be treated with the Nimba Tila etc. for the cleaning, Prakshalana, or then for the Ropana, you may use a taila with the all that Swartika, Saindhava Chitraka etc. Now this is exactly what you see in case of the foreign body granuloma or the pyramidal sinus like conditions, where Kapata, Bahu, Ghana, Arjuna Pichilasaha, Ratis Sutihi Stimita Kathina Sakandu, where the patient would have chronic, comparatively less painful, continuously discharging conditions. In all that conditions, the most important part of the treatment would be exploration and removing all that fibrous substances. See, in case of the Kapaja variety nadi or all such chronic sinuses, it's not only the product of inflammation like pus, it's about the fibrous tract which also would be affecting the healing. The fibrous material has to be removed. To remove the fibrous material, either it could be a surgical incision or simple curative or maybe the Kshara Sutra. The options can be many. Kshara directly also can be used, but the most important part is that if there is a foreign body like a hair, it has to be removed, or if it is any other substance like fibrous substance, that has to be curated out. Now, Nadi to Shalya Prabhavam, in case of the Shalya Janadi, again almost similar as that of the Kapaja Nadi, where there is a foreign body, the important is Nishkartya Shalyam Pravishodhya Margam, Samshodhayeta, Kshaudra Pragade Hitile, Ropadam Ashupuriyada, Kumbhika, Kardura, Kapita Bilwa, Vanaspati Nam Chashalat Vargehi, Krippa Kashayam, Vipachektilam, Apyam Sta Sarala Priyam Guhu, Sugandhika, Mocharasa, Ahipushpam, Rotham, Vizadya, Apipat Bhatakincha, Yetena Shalya Prabhava Nadi Rohe, Branoba, Sukhama Shteva. In case of the foreign bodies which are presented in the deep layers of the sinus, again it's the same protocol. You have to open the sinus and then remove that foreign body. Source of inflammation has to be removed. Then followed by the Shodhana and the Ropana, which is a general protocol. Drugs used for that would be something like Brahmana Dravyas, like Kharjura, Kapita, etc. are used like. And in such conditions, again, the typical clinical presentation as described by Sushila is नष्टं कथञ्चित् अनुमार्गम् उदीर्षेषु स्थानेषु शल्यम् अचिरेण गतिं करोति सा फेनिलं मथितम् अच्छम् अस्य विमिश्रम् उष्णं स्रवेत सहसा सरोजाति नित्यम्. There will be repeated episodes of the discharges which may be foamy or may be blood stained, and in all such conditions exploration is a must. Now, whether you can remove the whole granuloma or you can explore and leave the granuloma tissue to be removed in due course of time is the other choices. Right? Now, another option which is suggested by Sushila is the Kshara Sutra. Now, very interestingly, Kshara Sutra is described in the context of Nadi Vrana, not in case of the Bhagandara. But now, in the clinical practice, we use Kshara Sutra in the Bhagandara quite frequently. Almost they are very similar conditions in terms of the pathology. The suggestion of Kshara Sutra mentioned by Sushila is कृश दुर्बल भीरूणां नाड़ी मर्माश्रिता या क्षार सूत्रेण ताम छिंद्यात नष्टस्त्रेण बुद्धिमान. When a surgical removal, surgical excision of a sinus is not possible either due to the general condition of the patient or due to the anatomical location of the sinus, where there is a possibly more damage to the tissue than really the treatment, Kshara Sutra is preferred, where Kshara Sutra is used for chedana, fistulectomy, the sinusectomy. Removal of the sinus is done to remove the fibrous tissue and all that debris. Kshara Sutra is used. And the protocol of Kshara Sutra is Yeshanya Gatim Anusya Kshara Sutram Sarinium Suchim Nidadhyat Gatyante Tatha Unnamya Ashunesh Kareta Sutrasya Antam Samaniya Gadham Bandham Samachireta Tasa Ksharabalam Viksha Sutram Anyat Pravesheta Ksharaktam Matiman Vaidyo Yavanna Chidyate Gatihi Bhagandarepi Esha Vilik Karyo Vaidyena Janata Arbodashija Ukshipya Mude Sutram Nidhapeta Suchi Yavakra Achitam Samantara Mure Sutrena Badnyata Chinnacha Upachare Pranam. Kshara Sutra can be used in different techniques. Either it could be like it has to be inserted into the tract followed by a probe. So you have to initially probe the tract, identify both the openings of the tract, and only when there are two openings, this kind of a technique where the railroad technique, Kshara Sutra is applied into the tract and then tied over the area. Then as regular intervals, that Kshara Sutra has to be changed by tying another thread, which is now popularly done, commonly done in case of the fistula, and we call that technique as railroad technique. Like one thread is applied, next time you tie the thread to the new thread to the older thread and then pull out. So this way you have to repeat, and so that the whole tract is excised. That's one option. Or other option could be in depending upon the type of the lesion, like Arbuda lesion. The same technique can be used in Bhagandara also. Sushila has suggested that same. Then in the Arbuda-like conditions, a transfixation can be done. The Mure Sutram Nidhapayata, the lesion which is having a pediculated appearance, at the pedicle base of that, you may tie a Kshara Sutra so that that produces a necrosis. Now, if you cannot tie directly, then with a needle, a curved needle, you can insert the Kshara Sutra at the base, and then again you tie. A transfixation suture can be done. So, transfixation to remove the tissue or a railroad technique insertion are the two options of the Kshara Sutra which are mentioned by Sushila. And of course, in the present day situation, the Kshara Sutra used in Bhagandara, in the fistula, is mainly the railroad technique. The other options also are tried often in many conditions like polyps, warts, etc., corns, etc. Then the Divraniya Abhitaha Tatu Vartyastaha Sarvanadisha Bhishakvidadhyata Gonta Palatwag Labanani Laksham Pugi Palam Cha Alavanam Chaputram Snuhi Arkadudhena Chakalka Esha Varti Kuto Hanti Achiren Nadihi Bhipitaka Amrasti Vatapravalaha Harenuka Shamkhini Bijam Syaha Varahi Kandashtra Pradeyo Nadish Tailena Mishraitwa Dhatturajam Madana Kodravanja Bijam Chakash Koshadaki Shuganasa Mrigabhojini Cha Ankota Bija Kusumam Gatishu Prayojam Laksha Udaka Ahtam Alasa Vikrutya Chunam Tatacha Gomam Samasim Hidaya Koshashirasya Adarto Dishanti Vartikritam Makshika Samprayuktam Nadignam Uktam Lavanottamam Va. The other option in case of the Nadi Purana is Varti, wicks which are used, like suppositories or wicks which can be used to which keep the opening patent. So once you have kept the opening patent, the drainage is possible. Now a wick can be successful if there is not much of a fibrosis in the tract and the products of inflammation are mainly purulent, pus-like products are there. Then by keeping the opening patent by a wick, you can expect the wound to heal. But if it's a chronic and fibrous one, or if there is some source of irritation like a pyronial sinus or a foreign body, a wick may not be successful. Anyway, so selectively you can use the wick as one of the options. That's what Sushra has said. And preparation of the wick and their training these materials, they are discussed in the Dirvaniya chapter, Brada Chikitsa chapter as such. Then the other options would be application of the Snuhi Dugdha or Arkadugdha, Tishna latexes of irritant latexes of the plants along with the different plants material like Ghunta, Palaktok, Lavanani, etc. Or the Taila of material, Bibitaka, Amra, etc. The variety of Taila can be used for treatment there. Or Churna, depending upon the condition. Churna is, of course, these are the issues which you have discussed in case of the Vrana Chikitsa. Now, another very interesting issue is Susha even suggested a Gomamsa Masi, the flesh of the cow, burnt, charred, can be given in case of Kostashrita nadis, sinuses related to the viscera. Gomamsa Masi is suggested. So, Gomamsa, the flesh of the cow being eaten in Sushra's period, question mark, all that debate whether Gomamsa was eaten in India earlier or not, I am not going to that part, controversy, but Sushra had used the Gomamsa as a medicinal uses, or either it could be given internally or it also can be used as a wick. दुष्टप्रणे यद् विहितं च तैलं तत्सर्व नाडीषु विषद्यात् चूर्णीकृतेः अथ विमिश्रितं येभिः एव तैलं प्रयुक्तम् अचिरेण गतिं निहन्ति येष्वेव मूत्रसहितेषु विधाय तैलं तत्साधितं गतिम् अपोहति सप्तरात्रात् पिण्डीतकस्य वा वराहविभावितस्य मूलेषु कन्दशकलेषु च सौहेषु तैलं कृतं गतिम् अपोहति शीघ्रमेतत् कन्देषु च अमरवरायुधसाह्वयेषु भल्लाटक अर्क मरिचैः लवणोत्तमेन सिद्धं विडङ्गरजनीद्वयचित्रकेश्च स्यात् मार्कवस्य च रसेन निहन्ति तैलं नाडीं कफानिलकृताम् अपचीं वृणंश्च. Different taila yogas are mentioned, and it could be like a taila simply prepared with the same drugs and along with the churna, or taila with the drugs, gomutra also can be prepared with the same drugs as such, as well as the varaha majja, the pigs, these fat content of the pigs can be used, fats of the fat. Or it also can be used, taila can be prepared with Dhanatakarka, etc., depending upon the conditions. So that's about the Nadi Chikitsa. Then, as in case of the Niranasthana, Sushila has mentioned Sthana Roga in the same context as such, and hence the treatment also. In the Sthanya Vikriti, again, whether this has to be in the context or not, we have discussed that part, whether it's considered out of context or not. Of course, from the current point of view, it looks like out of context, like when you have discussed about the abnormalities of the milk in the context of the visarpanadi or such cellulitis-like conditions may look odd, but from Sushra's point of view, when it has to be infective pathology and which can affect the generations together, it's quite justified. So we will not go into that controversy. Like the management would be in case of the Stanya Vikriti, the abnormalities of the milk. Stanya Gate Vikriti Mashu Bishakt Dhatrim Pitam Bhutam Parinate Ahani Vamayeto Nimbodakena Musumagadikayutena Vantagate Ahani Chamudgara Sasanasyat Evam Treham Chaturaham Shadaham Medva Sarpit Pibe Tripalaya Sahasayutam Va Bhangi Vacham Ativisham Suradar Patham Mustadikam Surasam Katurohininja Dhatri Pivekupayas Parishodhanartham Aragvadhadishivaram Mudhana Kashayam Samanyam Edad Upadishtam Ato Visheshat Doshan Payodipatidan Shamayat Saswam. In general, to make the milk more acceptable, more physiologically acceptable, any of the abnormal contents to be reduced, the mother has to be given Vamana and the vamana could be repeated at regular intervals to facilitate that there will be a proper milk formation. And the other drugs which are given could be Tifalakrita or Bhargi, Vacha, etc. The drugs also can be given with the milk to the patient to facilitate the proper milk formation. Rogam Sanothitam Avekshapishakta Vidadyat Chidya Vitasdo Abhihatam Bahusho Vidhanam Sampatyamanamapitam Vina Upanahi Sambhojanena Kalu Pachaitam Yateta Shikram Stanohi Mudumam Sataya Upanabdha सर्वं प्रकोतं उपयाति अवधीयते च पक्वेतु दुग्धहरिणीः प्रहित्यनाडीः कृष्णं च चुचुकयुगं विदधीतशस्त्रम् आमे विदाहिनी तथैव गते च पाकं धात्र्याः स्तनौ सततमिव निर्जुहीत. In case of the breast abscess, septic complications which occur in the breast, the treatment has to be again as in any other conditions, but the pachana, the suppuration, you are not supposed to wait till the suppuration signs are seen. So suppuration has to be done very carefully, because once it becomes suppurated, because the breast has a soft tissues, you are not supposed to wait till the signs of fluctuation are seen. That's absolutely, even now the protocol of dealing with the brain, these breast abscess is the same. Like you are not supposed to wait till the sepsis has been occurred, because of the two reasons. One, because it has a fat content, and hence once the necrosis starts, it could be very severe and it can damage the glandular structure as a whole. And the other is the gravitational dependent area. First, drainage would be difficult because you do not have a muscular layer which squeezes the breast. The drainage would be difficult, and hence the drainage has to be very efficient. And the present protocol says, like whenever you have to drain a breast abscess, there has to be a counter incision on the gravitational dependent area. Unlike other conditions where you locate the pus by the fluctuation test, you are not here in case of the breast, because even otherwise the normal breast would have some sort of fluctuation. You may miss the location, and hence you need to be very careful, locate the pus properly. And whenever you make an incision, it has to be a radial incision in a radial direction, so that the ducts are not damaged. And that's exactly what Sushil says. Pakvet Dugdharini Parhitya Nadi. Whenever you make an incision, that Dugdharini Nadi, the ducts of the glands have to be avoided, and that can be avoided by making a radial incision. At the same time, the nipple and areola also have to be protected, and hence the treatment has to be as in case of any other septic complication. With this, we conclude this chapter. Iti Sushrutamitaam chikitsa31 visarpanadi stanaloga chikitsa nama saptadashodhyayah. If there are any questions, we will try to answer. Right? Okay. There are no questions. So, fine.